Hey everyone, today let's talk about how we can
advocate for sexual and reproductive health and rights while promoting climate resilience.
Young people play a crucial role in advocating for sexual and reproductive health and rights, as to building climate resilient health systems and societies. SRHR often gets left behind in climate crisis planning because the focus tends to be on immediate survival needs, overlooking the critical impact that losing access to sexual health services can have on young people. Here's how you can make an impact. Okay, so step 1. During climate crisis, access to sexual health services like contraception and STI testing can be disrupted. This can lead to poor health outcomes, increases in the spread of STIs, and unsafe abortions, just to name a few. By sharing facts and stories on platforms like TikTok and Instagram, you can educate your peers on why SRH services are essential even during emergencies. Step 2. Take action. If you're in Los Angeles, here's a specific action you can take. Reach out to Planned Parenthood Los Angeles and ask how you can support their efforts to include SRHR in climate resilience planning. You can also contact the Climate Reality Project and advocate for the integration of sexual and reproductive health rights in their climate strategies. In addition, contact your local representatives using Common Cause's Find Your Representatives and urge them to prioritize SRHR and climate resilience initiatives.
Step 3. Promote access to sexual and reproductive health services. Healthcare integration is a big point. And to ensure that sexual and reproductive health services are integrated into these primary healthcare systems, especially in areas that are most vulnerable to a climate emergency, you can start or support petitions calling for local and national government to prioritize sexual and reproductive health services in their healthcare integration plans. Or you can write letters to local policymakers to urge for the integration of sexual and reproductive health services, and you can include examples such as hosting mobile clinics to reach remote and underserved populations. Step number 4. Conduct research.
This is the fastest catcher on the Indian town. You don't play.
Gather evidence on the impact of climate crisis on sexual and reproductive health in your community, and you can use this data to inform your own advocacy effort. And if you got a little personal narrative you want to tell, slide that in there too.